do have to take into consideration of arthritis. When I try to straighten his knee, usually I do traction. Definitely we do traction, and I try not to use all my hand because my hand is not as strong as my leg, okay? My leg is this big, my hand's like only this. So I use, kind of like position the leg right here, and I use my leg to go like here. And also I can put my thigh like on top of the calf muscle, and that's much easier. So that's another way. And you can put your hand on a finger on the joint space, and you can feel the joint space kind of like opens up. Yeah, like here, and my leg goes this way. Yeah. And I can, of course, I can push down with my hand to use gravity to help me a little bit.
Traction will then help him with the extension, or just give him a little bit more?
Give it a little bit more because it is concave on convex. And when you separate the joint space, you have more room to move, right? And also because it's concave on convex, we need to open up the space on the interior aspect. So after you separate the joint space, you can do a little bit upward glide. Okay, that's the joint itself. But for patellofemoral joint, when the knee goes into extension, it's superior. So you can push that a little bit when you go to extension. There's a third component. The third component is the tibia goes a little bit external rotation. It's called screw home mechanism. So you can do one at a time, traction, and a little bit upward or interior glide like this. Okay, and then when you separate the joint, stretch a little bit, and you can do upward glide, cup the patella, and do a little bit superior glide, like this way. Okay, and superior glide, and you can also do a little bit external rotation, like this way. Yeah. So you can do this, upward, superior glide, and screw home mechanism. All three together.
Combo pack.
Combo pack. So eventually, yeah, and afterwards the knee will be straightened a little bit. Soft tissue wise, we do need to consider both hamstring and the calf muscle. They both go across the knee joint. So you need to stretch the hamstring and also stretch the calf. They both can make the knee bend when he tried to walk.
He was really tight on the inside.
I think the issue with him is that he has tight hamstring.
Yeah.
So when he pick up the knee, the hamstring is in a relaxed. When the hamstring is in a relaxed position, he can straighten out his knee much easier. But if the hamstring is tight, like he's going up like that, then it's hard because hamstring pulls the knee in flex position. So there's a lot of things to, a lot of things, joint, soft tissue around it, body mechanic, and that's why this is an art.
So do you think leg press would help him or no?
It will. It will. So the leg press goes after you stretch all the soft tissue. It serves as like an activation procedure. So you can learn all the dance move and everything, but when you try to put into a play, that's different because one after the other, that's called activation. So you need to kind of get it activated so they know when to fire which muscle.
Okay. Yeah, I think that'd be good for him.
Right.
Next time.
Yeah, and you'd be surprised. A lot of people think, oh, I can do leg press, but when you ask them to do long arc quads, they cannot do it.
Can't do it.
It's different. The brain sees that it's different, and I can press, I can push this, but I cannot do this, and it's very common to see in patients. Yeah, because they think this is two different moves.
So that must have been why then it was easier for him to, like a step up, he's having to push down, and that's why he could straighten it way better.
Right.
Than just doing it out of
It's kind of like a reflex for the brain. It's kind of like survival skill to push, to stand, to walk, to go hunt, But to kick up, there's no function with it, besides play soccer.
Okay.
Yeah.
Okay, that makes sense.
Makes sense?
Cool.
All right, cool. Good questions.